Hi everyone, welcome back to my YouTube channel. Today I will be talking about Inpatient Rehabilitation Facility or IRF Prospective Payment System final rule for the fiscal year 2022. Let's jump right into it. On July 29th of 2021, the Centers for Medicare and Medicaid Services or CMS issued a final rule to update Medicare payment policies and rates for facilities under the Inpatient Rehabilitation Facility or IRF Prospective Payment System and finalize policies under the IRF Quality Reporting Program or QRP for fiscal year 2022. CMS published this final rule consistent with the legal requirements to update Medicare payment policies for IRFs on an annual basis. Fiscal year 2022 IRF PPS payment rates and policies will be effective on October 1st, 2021. Updates to IRF payment rates. For fiscal year 2022, CMS is updating the IRF PPS payment rates by 1.9% based on the IRF specific market basket estimate of 2.6% less a 0.7 percentage point productivity adjustment. In addition, the final rule contains an adjustment to the outlier threshold to maintain outlier payments at 3% of total payments. This adjustment results in a 0.4 percentage point decrease in outlier payments. CMS estimates that the overall IRF payments for fiscal year 2022 would increase 1.5% or $130 million relative to payments in fiscal year 2021. Now let's talk about Inpatient Rehabilitation Facility Quality Reporting Program or IRF QRP final rule updates. The IRF QRP is a pay-for-reporting program. IRFs that do not meet reporting requirements are subject to a 2 percentage point or 2.0% reduction in their annual increase factor. CMS is adopting one measure and finalizing its proposal to update the specifications for another measure. In addition, CMS is finalizing its proposal to modify the number of quarters used for public reporting of IRF quality measures due to the public health emergency and sought comments for two requests for information. Closing the health equity gap request for information. CMS's ongoing commitment to closing the health equity gap in IRFs has been demonstrated by the adoption of standardized patient assessment data elements, which include several social determinants of health or SDOH that were finalized in the fiscal year 2020 IRF PPS final rule for the IRF QRP, which can also be found in 84 Federal Register 39149 through 39161. CMS sought feedback in this request for information on ways to attain health equity for all patients through policy solutions. CMS will take all comments received into consideration as it continues work to address and develop policies on this important topic. It is their hope to provide additional stratified quality measure information to providers related to race and ethnicity if feasible. The provision of stratified measure results will allow IRFs to understand how they are performing with respect to certain patient risk groups and to support these providers in their efforts to ensure equity. COVID-19 vaccination coverage among healthcare personnel or HCP measure. In the ongoing efforts to address the COVID-19 public health emergency or PHE, CMS is finalizing the adoption of the COVID-19 vaccination coverage among HCP measure. This measure is designed to help assess whether IRFs are taking steps to limit the spread of COVID-19 among their healthcare personnel, reduce the risk of transmission within their facilities, and help sustain the ability of IRFs to continue serving their communities through the public health emergency and beyond. Public reporting of the COVID-19 vaccination coverage among healthcare personnel measure will begin with the September 2022 Care Compare Refresh or as soon as technically feasible based on data collected for the fourth quarter of 2021, which runs from October 1st of 2021 through December 31st of 2021. Transfer of health or TOH information to the patient post-acute care or PAC quality measure. CMS is finalizing updates to the denominator for the transfer of health information to the PAC quality measure. Currently, the measure denominators for both the transfer of health information to the patient post-acute care and to the provider post-acute care quality measures include patients discharged home under the care of an organized home health service organization or hospice. In order to avoid counting these patients in both transfer of health measures, CMS is removing patients discharged home under the care of an organized home health service organization or hospice from the definition of the denominator for the transfer of health information to the patient post-acute care measure beginning with the fiscal year 2023 IRF Quality Reporting Program. Public reporting of quality measures with fewer than standard number of quarters due to COVID-19 public health emergency exemptions. In March 2020 and in response to the COVID-19 public health emergency, CMS granted an exception to the IRF Quality Reporting Program requirements for calendar year first quarter of 2020, which was from January 1st, 2020 through March 31st of 2020, and quarter 2 of 2020, which was from April 1st of 2020 through June 30th of 2020. CMS also stated that any IRF quality reporting program data that might be significantly impacted in terms of measure reportability and reliability by these exceptions would not be publicly reported for first and second quarters of 2020 due to the absence of usable data these exceptions created. CMS is finalizing its proposal to update the number of quarters used for public reporting to account for this exception. For the accepted refreshes to the Care Compare website affected by the quarters, CMS will calculate IRF Quality Reporting Program measures using 3 quarters, third quarter of 2020 through first quarter of 2021, of data for assessment-based measures and 6 quarters for claims-based measures. CMS will use this methodology for the following affected refreshes. For the assessment-based measures, the affected refresh is the December 2021 refresh. For claims-based measure, the affected refreshes occur from December 2021 through June 2023, where the data will be updated in the December 2021 refresh for the fourth quarter of 2018 through fourth quarter of 2019 and the third quarter of 2020, and the September 2022 refresh for fourth quarter of 2019 and third quarter of 2020 through the third quarter of 2021. For the earlier 3 affected refreshes, March, June, and September of 2021, CMS will hold constant the Care Compare website with December 2020 data. Fast Healthcare Interoperability Resources or FHIR in support of digital quality measurement in post-acute care quality reporting programs request for information. CMS is working to further its mission to improve the quality of healthcare for beneficiaries through measurement, transparency, and public reporting of data. The IRF Quality Reporting Program and CMS's other quality programs are foundational for contributing to improvements in healthcare, enhancing patient outcomes, and informing consumer choice. CMS believes that advancing its work with use of the FHIR standard offers the potential for supporting quality improvements and reporting, which will improve care for its beneficiaries. CMS sought feedback in this request for information on its future plans to define digital quality measures or DQMS for the IRF Quality Reporting Program. CMS also sought feedback on the potential use of FHIR for digital quality measures within the IRF Quality Reporting Program, aligning where possible with other quality programs. CMS received a number of comments which they will consider as they develop future policies in this space. Further, CMS plans to continue working with other agencies and stakeholders to coordinate and to inform their transformation to digital quality measures leveraging health IT standards. I conclude my presentation with a reference slide. Thank you for stopping by. If you found this information useful, please consider subscribing to my channel. See you next time. Bye now.